Hi, everyone. Welcome back to the Slimming Surgeon podcast. I am your host, Dr. Kandace Kichler. Today, we have a special guest, Boliek. She is a physician assistant and business owner. So she has focused on health and wellness for 18 years. I know she doesn't look that she could be, over 18 years old, but she has. She started as a personal trainer, a cycling instructor, and a running coach, which then led to her owning her own fitness studio while working full-time as a PA or physician assistant in orthopedics and HRT/TRT, which we will dive into. And now she's continuing to help patients feel better about how they feel in their skin and looks with an aesthetic aspect to her new job. And she is actually joining us at Haas Plastic Surgery. Mm-hmm. So I am so honored to welcome Erica.
Thank you. Thank you so much for having me. This is a pleasure. I'm very excited. I've not talked a lot on podcasts, so bear with me if I mess up. But
you won't. There's a first time for everything.
I'm usually pretty good ad lib. We'll see what happens.
Okay. So I compiled a list of questions that I thought our viewers or our listeners would want to hear about. Everything from fitness to HRT to aesthetics. So let's just dive in and we'll see where the combo takes us. First things first, what's your workout routine? Because you're very fit.
So I typically, and now mine, I will say, is very different from everybody. It's no one size fits all. I'll say that over and over, but I do work out every day. Mm-hmm. My one day that I don't really lift weights or do excessive cardio, meaning, go run or cycle, I do a lot of just active walking. So like an active rest day. Mm-hmm. And I incorporate mobility, flexibility, yoga on those particular days once a week. So I get up 4:30 in the morning. I go do my workout. I lift heavy, kettlebells. I also do cardio, whether it's in the morning or evening. It depends on my schedule, but I do something every day.
Okay, so like the mornings when you used to be in the OR with ortho, you still worked out at 4:30 in the morning?
I did, yes. And I took everything with me because I know that my habit is I'm tired at the end of that day. Mm-hmm. A lot of times in that time frame, I wouldn't get out till sometimes 10 o'clock or even midnight in some cases. Oh, geez. And it was a long day and I knew it wasn't going to happen. So it had to happen that morning. And it's so important for me mentally more than physically to just set my day straight.
Yeah. I'm a big planner too. Like I love to plan out my day and have a morning routine. I think it's key. Like I think it's really important for successful people or people who have, lots of things to accomplish that you've got a plan. If you don't have a plan, you plan to fail, right?
Absolutely. Yep.
Okay, awesome. So being a PA, you've done a lot of, one-on-one, work with clients and patients, and you've done hormone replacement, you've done weight loss. Tell me, when do you start seeing women, we're going to talk about women for now, who are interested in hormone replacement?
Great question. So I would say the majority of my patients that I've seen are going to be women that are perimenopause and postmenopause. So it's those individuals who unfortunately are having hot flashes and weight gain and decreased libido, vaginal dryness, things that are so we don't talk about so often that they come to me and they're like, here are my problems. And I've been told there's nothing I can do. I'm just in postmenopause, but I just know there's got to be something. That is the majority of my patients. Now I do, in the recent years, start to see a younger crowd and obviously, hormone replacement therapy has its role in everyone. So it's a thorough workup for each of those individuals. But the majority are going to be my postmenopause women. We're really just wanting to live life.
Yeah. And how quickly, once someone gets started on the treatment regimen that you recommend, how quickly do they see an improvement in their symptoms?
So I would say majority of the hot flashes and, night sweats, progesterone cream, say I give that to them, they're noticing a difference within a few weeks. I always err on the side of caution that things can go up and down for the next few weeks, but by 4-8 weeks, they're pretty stable. They're therapeutic.
Okay. And do you also work with people who maybe have had a hysterectomy or oophorectomy, who have been surgically, changed?
Yes, absolutely. I also have worked with those individuals. it's not, depending if they need it for medical reasons or whatever they're looking to have it done for, they need care too. And they're going to go through a lot of ups and downs, and they're uncomfortable, and it's important to make them feel good. So that's why I do it.
Especially after surgery, if you have to have surgery for this, and then it's like you not only go through recovering from a procedure, but then you have all of the associated hormone imbalances afterwards, like that would be horrible.
Yeah.
To put it simply.
Yeah. And they're miserable, and then they're gaining weight no matter what they do. And, a lot of times they want to blame it on thyroid. And a lot of times it's not actually the thyroid.
I feel like everybody blames everything on the thyroid.
Yeah. Poor thyroid.
I know. and then there's like people who don't even have one and they're totally fine.
Yeah.
Whatever. Okay. So, and I just feel like there's such a taboo around hormone replacement for women, I am even guilty of thinking at one time, like, oh my gosh, I'll never do hormones. Why would I need that? My body is supposed to naturally do what it's naturally supposed to do. Like, what are your thoughts about that?
So I am fortunate. My background in Philadelphia, when I first started out as a PA, I worked with an OBGYN clinic, and my physicians I worked with, I'm going to give a shout out to them because they're still alive. They may hear this, Dr. DeBacalier, Dr. Filos, and Dr. Dipti. But they were amazing at really listening to the patient. And they taught me so much about these therapies are here for a reason. Now you have to find out, is this a therapy that's good for this person? And don't be afraid to give it and make them feel better. Listen to them. We were doing vaginal rejuvenation before people were talking about it.
Yeah.
And now I think people still don't talk about it, but as much, but it's more out there.
Right. And I think they're more open to the conversation.
Yes, absolutely. So I just trying to make that patient feel comfortable knowing that you're listening to them and you're looking at the whole picture, their family history, their age, are they having children? It's a multitude of things, and then the labs themselves.
Right. And I think, something that you're probably really good at is, giving that continuity of care, because if you're going to embark on this journey of hormone replacement and, trying to level yourself out, it's not a one and done. Like, you don't want to just go see someone, get a cream and then never follow up or never get your levels rechecked. I think it's going to be this type of treatment is a lifelong treatment. You're going to have changes as time goes by. And it's important to be, an advocate for yourself, but also following up with your physician or your PA so that you are doing the right thing for the long run.
Yes, absolutely. I work with a group also called Core Medical, and that's where I do most of my HRT, TRT. And I see my patients every 8 months for labs. And we always, as all my colleagues on the group, myself included, touching base with these patients every 3 weeks. Our care coordinators are making sure that they're being taken care of. They're not having issues. So, it's very much a connected group.
Yeah.
And we stay very connected to our patients, and I think they appreciate that.
And a lot of what you do is virtual. Is that right?
It is.
That's awesome. So you guys, if you need hormone replacement, call Erica.
Yes.
But what you said about younger, it becoming more of a conversation for people who are perimenopausal, I think that's huge because a lot of women, myself included, don't know that there's something you can do about this even before you've hit menopause.
Yes.
So that's really good to know. Now, kind of switching over to TRT, like, when do guys need to start testosterone? Or the associated hormones?
Yes. So that is a great question. Here's what I'll say. When we start to not feel like ourselves and we are trying to evaluate what is our problem, what's going on, why am I not sleeping well, why do I have brain fog, why do I not lift and recover like I used to, that can happen to men and women. And those are some tall tale signs of there may be some issues with the hormones. So work up that. I always say, if you're 20 years old, start your baseline labs. Start your baseline, know what they are, and then you're following them yearly until you may follow them even more, every 6 months or every 8 months.
Right.
Lab work to save your life and feel better and be able to function is not that big of a deal.
Right. Exactly. A little blood draw.
Yeah.
Okay. Yeah. A lot of my husband's friends, they're in their 40s now, and you can tell a difference in the ones who have kind of started this hormone replacement journey and who are seeing a doctor regularly, who are taking care of themselves versus those who are just, letting the dad bod take over. So I think for longevity's sake, it's important to at least be aware of where you're at and what your possibilities are.
Absolutely. I've been reading, I think it's Outlive. I can't remember the name right, but Peter Attat wrote the book and talks a lot about, living well in life, mental, physical. And that's an aspect that shouldn't be forgotten. If somebody's not recovering like they used to after a workout, or they're not sleeping well, well, maybe it's something to do with your testosterone or your estrogen,
right?
Which amazes me.
And there's crossover. Let's not be, let's not say estrogen and progesterone are for women, testosterone's for men. It's one in the, everyone can have all of them or whatever is needed, correct?
Yeah, exactly. And that's actually the biggest misconception I have to deal with. And I love my patients, but men will be like, wait a minute, I have estrogen in my body? And I'm like, yes. And if you don't have enough, you could get erectile dysfunction. Well, and guess what? If you have too much, you can have erectile dysfunction.
Yeah.
So it's like a fine line, and like teaching them that and having them understand it's huge.
Yeah. Okay. This is all good to know. So talking about, health, longevity, and getting older, you touched on, gaining weight. What right now are like some of your favorite things? Because you do some medical weight loss too, right?
I do, yes.
What are some of the things that you're seeing the most progress with? What have been your tried and trues? Like, just touch on what your thoughts are.
Okay, so I'm going to preface this with no one size fits all.
Yes, I think that's so important.
Yeah, and so weight loss medications, let's just go there. The big one right now, everybody hears about semaglutide or Ozempic.
Yes.
I have had patients on it. They have to meet a certain criteria. I do have a certain BMI that I'm looking for. Now, I don't love the BMI.
I don't either.
Scale.
Right. You got to look at the human.
Yeah.
Right.
And so I'm virtual though. So I have them stand up. I'm kind of doing an assessment. If I see that they have X amount to lose, 20 plus pounds more, and they're having difficulty, they've been trying, that's a great candidate for it, especially if their glucose is elevated after fasting and they're like, on the precipice
showing
of that
signs of insulin resistance.
Exactly.
Right.
So if they're in the pre-diabetic group and you're excessively, overweight, or you're trying to lose weight, 20 pounds or more, I would consider putting someone on it. And they do amazing. And, we do it at a very titrated dose. So this Ozempic face that people have talked about, I have not seen it. And at least from my patients, I have seen it in
other patients who have lost too quickly, maybe.
Exactly. Yeah.
Gotcha.
So or
maybe poor candidates.
Yes.
Yeah.
Exactly. So, that is one. Trizipatide, that Mounjaro, that's another one.
Okay.
If people can't tolerate that, the Ozempic, I'll use that one.
So tell us the difference. Like, what's the difference in those two? Is it just the binding molecule or the exact composition of the GLP-1?
Yes, it's just they're different in the binding component. They're both injections once a week, and you still have to titrate both of them up. So,
Okay. And then what about any pills? Because some people are so, adverse to doing an injection. I think it's becoming more common because literally everybody on the block is doing semaglutide. But, for someone, when I was doing, a lot of weight loss and with my bariatric patients, some people were like, absolutely not. I will not take an injection. Like, give me any pill on this earth before I put a needle in my body. What do you recommend for those people?
So I typically, especially if they're, again, having some insulin resistance, or I see their glucose is affected, excessive body weight, metformin. I love metformin. Tends to do well, a little less side effects. Phentermine was really big several years ago. That was like the hot topic, phentermine. I've been around everything in the fitness industry. I've heard everything that people pop or shoot or whatever, and I think I'm just not a huge fan of it. Unless
I think people get really used to it really quickly. You know, it's like they get one prescription, they feel amazing, they lose some weight, and then the next month they want double the dose, you know?
Yep.
Yeah.
So those individuals, I tend to say, okay, with every one of my patients, what is your exercise and eating habits that you are creating for yourself to set yourself up for success in the future?
Exactly. I think that's what's key, because so many people are taking these medications, but doing the same thing, except, while taking the medication, they're nauseous, so they don't eat as much.
Yeah.
But it's like, okay, you can't just take a medication, take an injection, eat pizza, but like a smaller quantity. And then when you stop it, eat a full pizza and expect to keep the weight off.
Exactly.
I think it's all of the lifestyle habits that have to be put into place.
Yeah. And, I always tell patients it's so important that, I try to say this in the most delicate way, is body composition, right? Increased risk of other diseases when we have a higher body composition.
Right.
And I've never had someone lose weight that hasn't come back to me and said, thank you.
Yeah.
And I do it in a very controlled manner so that we don't go haywire on the weight loss.
Yeah. Right. Okay. So one thing that I want to know about, and I think a lot of our listeners will want to know about, are peptides. Like, aside from semaglutide being a peptide, are there other peptides that you recommend to people? And have you taken, you don't have to tell us because that's totally personal, but like, I follow so many people on Instagram and they're like, oh, I take this peptide and this peptide and this. And it's like, am I missing out on something or what?
Yeah. So peptides, I love them. They basically are naturally occurring in the system. So we're just leveraging them at higher levels to make it the most easiest way to think of it. So for example, I will say I take BPC 157.
Okay, writing this down. BPC, just kidding.
Which is great for collagen and joint pain. Think of things like people who have shoulder injuries, hip injuries, or they kind of deal with like collagen deficits, issues like that. BPC 157. If you have back pain, I'm going to tell you to get BPC 157.
Okay.
It's an injection.
Are all of these injectables?
Not all of them.
Okay.
MK677, wild names. That is a second generation growth hormone. So that one is a pill.
Okay.
And that's going to help basically with lean body mass and recovery and sleep and all the things that is affected by growth hormone.
Okay. So if someone's like interested in taking peptides, like what do you recommend? Do you recommend them, like, where do you recommend them getting from, or who do you recommend them seeing?
So obviously we do prescribe it. And I do recommend that somebody who's going to get a peptide should make sure it's coming from a reliable source and that you're doing it the correct doses. Because I have had people, plenty, who have come to me and said, I did, CJC 1295. That's a big one for like body mass and lean body mass. And it's great for women if I pair it with testosterone for weight loss.
Okay.
And I have found that if they get it from a bad source, then your liver, your kidneys, something may be affected. So,
oh my God.
Yeah. So it's one
careful.
Be careful. No Greek. I don't know. Don't order it online.
Yeah. And well, that's exactly why I wanted to ask you that, because you see these things on every block and you wonder, okay, where are they getting this from? Like, who's compounding this? Like, are you actually injecting what you think you're injecting? Like, I think people really have to be careful and go to a, respectable provider, not just, Joe Blow down the street.
I agree. Absolutely.
And someone who's going to test your labs and your levels and monitor your body composition. I think all of that is really important.
Yeah. Because everything you take doesn't go without side effects.
Right. And then what are some of the side effects of like taking peptides? Like, if just in general?
So the biggest thing I hear is I don't feel good. I feel nauseous, or I'm cramping. I've had people complain of bad cramps, whether in the stomach or in the legs. Those are typically the biggest complaints I'll get.
Okay.
Which doesn't sound like a big deal, but trust me, these people are miserable.
To you, yeah. Right. If it happens to you, you're like, I don't ever want to take this again. But you're seeing benefits. I mean, we see people who are taking them that have had good results. It's like almost like a fountain of youth, I feel like.
Absolutely.
It's crazy.
And there are peptides that can help with the skin collagen as well. So I've seen some benefits from that as well.
So I think, combining the hormone replacement therapy, if it's needed and you're a candidate, with peptides when it's appropriate, with aesthetics, is like the fountain of youth, literally.
100%.
Okay, so let's switch over to that. Like, what got you interested in aesthetics?
So I have been working. Well, let me go back.
I know, maybe we should start from the very beginning.
So
you have such an interesting journey. Like, when you started, did you start working like right out of high school?
Yeah, pretty
Okay.
Yeah. I mean, I was actually in high school when I started my first group exercise class with the YMCA teaching.
Okay.
I was just like, I loved it and I loved exercise. And actually one of my mentors, Mary Barnes, shout out.
I love the shout outs. We're going to tag all of these people.
I know, right? She'll love this. She was one of my teachers, and I actually lost one of my best friends to cancer when I was very young, and she was my guiding light. Anyway, she said, hey, the YMCA is hiring. She was like our PE teacher, you know, and a health educator. And she goes, I think you'd be great for this. And I was like, what am I doing? She goes, we got to keep the gym floor clean, but they want a group exercise instructor and a trainer. And she goes, and you're now age that you can go do the YMCA certification. So I was like, all right, fine. So I did it. And that's where I started.
Okay. And then from there, so you taught at YMCA, which by the way, between undergrad and med school, I worked at a Gold's Gym.
Oh, yeah.
I was selling memberships, so I wasn't a group fitness instructor, but I wanted to be. Like, in spirit, I was a body pump instructor. I knew every move. I knew when they were going to call out what next, but back to you. Okay, so you worked at a gym, and then kind of tell me, like, what your progression was after that, because I think it's interesting.
So it's a whirlwind. I actually worked I'm going to skip a couple years. So then we were a running store in Charlotte, North Carolina. And I started with them, and then it's a specialty running store, Run for Your Life, shout out. And then from there, I was their running coach, and then I moved to Philly for my I was an athletic trainer, certified athletic trainer, and that's what I came out my bachelor's. Okay. And so I moved to Philly for a job, and then I went back to PA school. But during that time, I also opened up another running store, and I was a running coach for them. And so we did that, and North Wales Running Company now, and also Phoenixville. And so then amongst all that working that I was doing and training, I went back to PA school. And I graduated a little early from school, so it was a benefit to me age-wise. But yeah, so then I went back to PA school, came out, wanted to be an OBGYN. I thought I was going to go into ortho because I love sports medicine. Yeah. And I fell in love with the group. I fell in love with helping the women and helping them just feel better. And I've always just had the affinity to help people feel better about themselves. Yeah. It's never, for me, it's not about the weight loss. That's going to come. Yeah. When you're doing the work. Right. How you feel mentally and, you know, how your body, your heart, your lungs, all that, like it just plays so much of a role in how I give back to my clients and my patients. I want them to feel that way. Right. Live well. You know, my best friend passing away from cancer, you know, if I could do anything, I would want her to live well again. And, you know, that's what I try to do for each of my patients. So. Yeah. That's so important. I mean, it's really true. Like, if you don't feel good from the inside out, like, who cares if you're, you know, a size 2? Yeah. You know, who cares if you look good in this outfit if you don't feel good as a whole? Yeah. So taking care of yourself, you know, mentally, physically, and then, you know, physically, aesthetically, I think we need to make less of a taboo subject, you know? Absolutely. So then I moved into orthopedics when I moved to Florida several years ago, and I worked with a plastic surgeon on scar revisions. He would come in for the cases, we'd work together, and I kind of just was like, I like this. And I was always around it, especially being here in Florida. We hear about plastics all the time and, you know, breast augmentations, BBLs, and not the face BBL, but Brazilian butt lifts. And, but I was, as I was kind of going along my journey with my clients in my fitness studio, skip many, many years forward, I had patients say, you know, I would love to have a mommy makeover. And I'm like, do it. Yeah. What's holding you back? And they're like, I'm embarrassed, or I'm worried what people will say or what people think. Well, you know what? Don't worry about what people think, because that's a projection of how they feel about themselves. Right. And I think that is the biggest thing that I got drawn to the aesthetics and plastics world, because I was like, I want you to feel good about how you look too. You know, there's wrinkles on my face that I'm like, oh my God, what is going on? I don't want it right now. Right. So what? I don't want it. So I'm going to get rid of it for a little while. Right. I think you should be able to look as good as you feel, or as good as you want to feel. And I think, like, you having the fitness background, like, you understand that there is that huge stigma. Like, people,
some people in the fitness space, it's like, no, you shouldn't get plastic surgery. Like you can work that off, or you can look really good if you just get a little bit more muscle mass. I think that there's that misconception when it's like, okay, yes, to some degree, you can totally change your aesthetic look with exercise and diet. But, when you've had 5 kids, or you've had a set of twins, or you've lost 200 pounds, like at some point, surgery might be indicated and might give you the result that you're wanting.
Yes, absolutely. And I think, that's what I love about the group Haas that I've joined. Like y'all do an amazing job. And this has been a couple years in progress too, for me to switch over into this world. But I would never go back. I would never do another group, because this is a group who sees the patient for who they are.
Yeah.
And I love that.
I know. I think our goal, which like you're in line with this goal, is to build confidence in people. It's not just about like how many breast dogs we can do today or how much money we can make. It's more about, someone comes in, they have a problem, they have something that's been bothering them. They look in the mirror and they don't see themselves, and we help them see the view that they want.
Yes.
We get them there. And I think that's been like so rewarding, at least for me as the surgeon, because the afters are so awesome.
Yeah, they're amazing.
So good. Okay. So another topic that I want to talk about, you giving us your background and your journey, like you must be a naturally driven person. Like, where do you think that came from?
So I would have to say it comes from my father. He's always owned his own business. I grew up on a farm, and he still does, a tire and wheel store, a mechanic shop. Always has, been very driven. I used to watch that man work on the farm, and from 6 in the morning, 5:30 in the morning until late at night, and, when we needed to. And so
are we the same person? I grew up on a farm also.
Really?
Yeah.
I didn't know that.
I didn't either. Here we go.
Yeah. So it was like one of those things where you're up and you have to get going. And
it's not an option to be lazy.
There's responsibilities, and you were all expected to join in on that responsibility. And I can't imagine having a different or better lifestyle growing up. I mean, I learned so much. Yes, it was hard.
Yeah. And you didn't want to do it. At least I didn't. I was like, no, please don't make me.
Yeah. And,
I would beg to stay inside.
Yeah. I was like, please let me just eat biscuits this morning. I don't want to go outside. But yeah, it was one of those things where he always was pushing me. It was, and sometimes people would be like, oh, daddy issues, because it was never enough, but he knew when to step back also. And, so it was one of those individuals like him and Mary Barnes, who I mentioned earlier, who's just like, you have so much potential, do good, and you're going to be fine.
Right.
And so I guess I've always just had that from him from little up. And I don't know what happened to my brother. Not just getting at him.
I know, right? Isn't it so funny how we all turn out so differently? I have three siblings. I have 2 sisters and a brother, and we're all pretty successful, but it's just, the different walks of life that you see, and that I'm already seeing with my little boys, even though they're like tiny. You can tell the personalities are just so different. But I mean, I think a little bit of daddy issues is good for everybody. The fact that you were pushed, but like to a good degree, and like were instilled with that work ethic from such a young age. I mean, that's why you got to where you've gotten so far.
Yeah, I didn't.
And will continue to get places.
I didn't have the opportunity, nor did I really care to have the opportunity to go party when I was younger.
Yeah.
Now, did I do it when I was in my late 20s, early 30s? And yes, I did plenty.
We all do. Right.
But I didn't drink till I was 25 years old. I had my first, sip of beer at that age. And so it was one of those things I always knew I wanted to do more and do more.
Right. So, back to, just like running a business, like, and being driven and being successful, like, what do you think are some of the key, factors that a leader or business owner has?
Consistency.
Okay.
Being consistent. It's funny how you hear these these terms come out on social media now, and people talk about progress over perfection, where when I was growing up, it was perfection and progress.
Yes.
You didn't have an or.
Right.
So you did both. But nonetheless, it's being consistent and sticking with it every day. Once you create that habit, coming out of that routine, again, falling into a routine is another important part of that consistency. So it's just a snowball effect. Each of them works synergistically with each other.
I mean, this is just like basic stuff for you and I. Like, we both realize this, but I feel that so many young people do not have this guidance, you know?
Yeah.
I feel like it's really hard for young people to comprehend work ethic and drive and passion and, you know, getting what you work for.
I agree. I think I see it in, you know, cousins. We're the oldest of a very large family. My great grandmother had 17 children. So let's just start there.
Yeah.
But, you know, I love my family, but I would say the work ethic has definitely changed over the years, and what you see now compared to what you used to see. But it's, you know, also I will say some young people see the importance of getting out the door and starting something for themselves.
Right. I know. Props to those girls and guys.
Thanks for the few.
Yeah, exactly. You're one of a kind. Like Lara at our office. She's amazing. She's so good. She's just like on top of it, wants to work, you know, is happy to be there with a smile on her face. I think, you know, too many people were also stuck on screens and things like that. And it's just a totally different generation. But probably our parents were sitting here, you know, but not in front of a mic with headphones on, saying the same thing about how awful we were, you know, and what a bad generation we were. So, you know, I think we have to take it all with a grain of salt, maybe.
Yeah. It's funny. My dad called me. He calls me every Sunday, and he said, "What are you doing?" And I said, "Oh, I'm laying out by the pool. It's my only day off. It's a Sunday. Every Sunday I'm off." And, he goes, "Well, I've already mowed the lawn." Like it's a competition.
It totally is.
I'm like, okay, well, congratulations.
Right. Okay. So let's flip back to aesthetics for a little bit. So you are going to start injecting, or you have started injecting at Haas Plastic Surgery. What are some of the things that you have found like interesting, or, you know, what has been your experience thus far?
So thus far, I would say the whole group is amazing. I love the approach to the patient that they have instilled in the providers. As the providers, the mid-levels, you know, that I work with, and all you as surgeons, how, you know, it's top to bottom. We're looking at the whole patient. We're listening to them. We're asking them. It's one-on-one, which is a part of the care component that sometimes gets lost.
Yeah.
You come in, you look at what the complaint was, and then you're like, okay, well, I think you should do this, this, and this, and then give you the plan and you leave. I've had plastic surgeons do that with my breasts before. They're like, well, no, what you need is X, Y, Z. And I'm like, well, that's not what I want, though.
Right.
And they're like, you're going to go up one size? That's not worth surgery. And I'm like, yeah, but that's what I want.
Right. Yeah. Maybe it is worth surgery.
Yeah. I mean, have you looked at them lately? I could probably still wear a training bra. But no, so it's one of those things where it's like, I see with Haas an amazing approach to patient care.
Right.
And, you know, with my training, no one size fits all. Right. Going back to that.
Right.
Each patient is so different. And I think, you know, Dr. Andrea Haas, Dr. Brian Haas, and yourself have done a great job. Even Hillary and Jennifer, my other two colleagues, and Ashley.
Yeah.
At showing and teaching me that. Because I am a midlife crisis turning into a new area of medicine. No, I'm just kidding. So I've had to learn a lot, and I've been learning a ton over the past year and a half or so.
Well, and I think like what we do, and the reason why we have set ourselves apart from other places, is that we do have that, you know, very personal component, which is not something that you're going to find at a med spa down the street, you know, or a place where you can get Groupon injectables. Like, who wants to go there when you don't know any of the qualifications of the provider that's giving you your treatment, but B, you know that their number one focus is the bottom line and how much money they're going to make off of said treatment. So, you know, I put that as a caution out to our listeners and our viewers that like, you don't want to go to just any random med spa. Like you want to go somewhere where it's going to be your place. We're going to go back. You're going to trust that provider. You're going to have that continuity of care.
Absolutely.
And where they're going to take care of you as a whole. Like, I think one of the interesting aspects is that we all have different backgrounds, you know, like Ashley and Hillary, they both worked in primary care, neurology. You've worked in primary care, OB, orthopedics. I've worked in bariatrics, general surgery. Like we all have seen other aspects of medicine, which is by design because we are all able to take care of the person and we're not only focused on the wrinkle on the face.
Yes, absolutely. And I also think we are able to create a subtle look to a face.
Yeah.
Where you the biggest thing we hear, right? And I've learned this over the last couple of months is I don't want my husband to know I'm doing this.
Right. I know. And then it's like, oh my God, don't bruise them. Don't bruise them. Don't bruise them.
I'm like, please don't bruise them. Don't please don't bruise. So, you know, that is one of the things where it's like doing it subtle enough that it makes a difference for that person.
Right.
And sometimes we have received patients from other places and we may not see that. And that's why they're coming to us, right?
Yeah.
To fix the problem.
Right.
And so, you know, that's something I'm learning as well. There's a lot of injectors out there. Be careful.
You don't want to look like an inflated balloon.
Yeah.
An over-inflated balloon.
Yes.
Maybe a slight balloon. I would go with the balloon look, but not too much.
I've only ever done Botox. So I've never done fillers and.
Okay. Well, we'll get you in the chair soon. No, you look great. You know, that's the good thing that you haven't needed to, because you've probably kept up with everything else as far as like your health and your wellness. You know, I think I really believe, and I believe this since I was young, that exercise keeps you looking young.
Oh, yes.
Like it is such a difference. People who have exercised consistently their whole life, or at least since, you know, they can make informed decisions, up until, you know, present day, they just look so much better.
Yes. And exercise as in, within no extreme. Meaning,
Yes, of course. You know,
because we know what happens if we go too extreme.
Right.
You don't look as good. You wear away your muscle. And that's the other component I like to bring to people's attention. And there's patients in Haas that I've had, and me and Dr. Haas have been talking to them, and they're like, well, I take XYZ. And I'm like, you know what? Why don't you incorporate turmeric, like, you know, 95% curcuminoids, and it's going to help you with inflammatory. Like these are things that you could incorporate when you're talking to a patient there.
Wait, so what are you recommending this for? Well, maybe I need to take this.
So it's anti-inflammatory.
Yeah.
And so everybody hears about turmeric. It's the most studied. Vitamin D is, but it's one of the most studied supplements.
I love vitamin D.
I love vitamin D.
I take vitamin D every day. And then especially if I feel like I'm getting a cold, I'm like extra dose.
Yes. You can take up to 12,000 IUs a day.
Okay.
Safely. Studies have shown this. Systematic reviews over and over. 5,000 a day is probably fine.
Yeah.
But yes, like turmeric, and going back to, it's an anti-inflammatory. So if you have joint pain, you have inflammation like redness from rosacea, things like that, it has been shown to help. Now, what most people don't know is it has to have a carrier, like black pepper.
Yes.
So you go and buy a supplement that just says turmeric. Well, guess what? You're wasting your money.
Yep.
That's the other danger side of supplements. So I'm like, you have to make sure it has XYZ.
So with vitamin D, do you have to pair it with K2, or like, why are people pairing it with vitamin K?
It's supposed to be more readily bioavailable.
Okay.
So I do say vitamin D3 with K.
Okay. Yeah. I mean, that's what I take. I read about it and I was like, oh yeah, I guess I should do that.
Yeah.
Okay. What supplements do you take?
So I have my B12 complex.
Okay.
I use a B12, a vitamin D, a multivitamin. I use a biotin. Actually, it's Oli Hair. They're Undeniable Beauty gummies, because I love like that for my sweets.
Yeah. I know, right? It's like a little candy treat in the morning.
Yeah.
That's my prenatals.
Exactly. Yeah. So I just pop that. Prenatals is what I use for a multivitamin.
Okay.
Any woman of childbearing age should have a prenatal vitamin.
Right.
Irregardless if you're getting pregnant.
Right. And you know, once I got pregnant with my second son, Cam, I I started having nausea, and I was like, what the hell? Like, I did not have this with Charlie. So I was convinced I was having a girl. I was like, it's definitely got to be different. But actually, I wasn't on prenatals for a while. Like, I just had stopped taking them, like my subscription ran out, whatever. And then I looked it up, and it actually, there are studies that show if you're taking the prenatals before you get pregnant, you're less likely to have nausea during the first trimester.
Yes.
Didn't know that.
I know. Most OBGYNs won't even tell you.
I know. Isn't that crazy? Okay. So you take all those supplements, which I think is fine. Like some people would say, oh, you don't need to take all of that. You're just peeing it out. Like, what are your thoughts on that?
Okay. So vitamin B12, absolutely. You could be peeing it out, but you're not going to hurt yourself.
Exactly.
It's not going to hurt your kidneys.
Right.
Studies have shown you can take a lot of it. Mm-hmm. If I was taking creatine, that's another story. It needs to be a particular type to really be bioavailable, and creatine monohydrate, and you should cycle on and off of it because you can't store it. It is rough on the kidneys, and you're just wasting that supplement. Vitamin D, it's fat soluble. You're going to store it if you have excess. Again, get your labs. Every 8 months, I'm running my vitamin D to make sure that I'm not too high. I mean, there's symptoms, diarrhea, constipation, things that can go along with too high of a vitamin D.
Right.
So you're looking out for those things too. Honestly, I'd rather have the supplement in me than not.
Right. I mean, and that's a big thing. Like, we found through COVID that so many people were vitamin D deficient. Why is that?
Not taking it. You don't get enough. You don't get enough in the sun.
Well, especially we're not getting enough in the sun, but also we're all like slathering our bodies in sunscreen. So it's like you're not absorbing things the way that you normally would. We're not out in nature. I think there are so many factors that contributed to that. So why not just take the supplement?
Yeah. It's not going to hurt you.
Right. Okay. And do you have thoughts about sunscreen?
Oh my gosh. I love sunscreen.
Do you?
I do. So when I was younger, no. I mean, you put baby oil on and lemon juice in your hair so it would be more blonde, and then got
tanning bed.
Yeah. And I did all those things. And then I have a Cherokee background. So my father, if you looked at a picture of him when he was younger, you'd be like, oh, wow. So, he has great skin, and he tans like olive very quickly, olive red. But I didn't wear sunscreen as well. And then probably turned 30 or so. And I was like, okay, I got really bad sunburn. This is it. And I just have done it ever since.
Yeah. I have always worn sunscreen because I used to work for a dermatologist when I was growing up. But now I'm like, I don't know. Do I really need it?
Yes, you do.
I do, because I don't go out in the sun. And if I did, I'd totally burn.
Yeah.
But, I think there is some, we're lacking sunlight. Like, we're lacking getting out in nature. So I think it's totally fine, especially early morning or evenings, to go out, get a little bit of sunlight, get a little bit of fresh air, do some grounding, all the frou-frou things.
Yes.
I think it's really good for us. Like, we are missing that because we're all hooked to technology all the time.
Absolutely. I don't touch my phone as much as possible first thing in the morning. I maybe do a positive post on my story, and then I'm done with it for a while. And I also have a timer on my social media.
Do you? What's your timer set at?
30 minutes.
For the day?
It is. And it's actually amazing. At first, I thought it would be hard. Yeah. It's actually not. I love it.
I need to do that.
I overrode the time a couple of times.
Yeah.
But mostly because me and my boyfriend are watching videos.
Yeah. Right. No, I know. I need to do that. I have a timer on Charlie's iPad. It's unfortunate how much he goes over it, but that's a story for another day. We'll have a parenting podcast.
Don't bring me on.
I know. Do you ever want to have kids?
So yes, I would. I don't know if it's in my cards.
Yeah.
I don't really worry about it too much.
Yeah.
If it happens, great. We've thought about adoption. I've thought about adoption.
Yeah.
Actually, when I was single for a lot of years. I was thinking about adopting just myself.
Yeah.
And I didn't, but I think it's one of those things that if it happens, it happens.
Yeah, right.
I have a fur baby.
Oh, dog, right?
Yeah, he's a dog. Aussie Doodle. He's 7 months.
Oh, wow, baby.
Yeah, and he's so high energy. We go for a 2-mile run every morning.
I was going to say, that's a lot. Yeah. Nick and I almost adopted a dog this weekend, but then we came to our senses. I think we were drunk. We weren't drunk. I'm just kidding. We were not drunk, but we literally thought about it. And then we were like, wait a minute, we both work and our nanny would be the one taking care of this dog. So we should probably run that by her first. first.
Yeah.
Right?
Exactly.
Okay. I think this has been like a really good conversation. Are there any other questions that you want to, or any topics that you want to get out there? Like, I know people can find you obviously at Haas Plastic Surgery, but I want them to follow you on Instagram. Tell us your handle. That way.
It's easy. It's my name, at Erica, Erica, Boliek, Boliek.
Boliek.
Yes.
Spelled a little weird, just like my name. Yep. Okay. So, I mean, because you are still taking on clients in your like telemedicine, HRT, TRT, wellness practice, right? You're going to continue doing that like part-time while you're doing the aesthetics with us.
Yes, correct. I have strived to create a pathway where I'm taking care of patients on all aspects.
Yeah.
And I'm actually secretly, nobody knows this. It's not come out yet, but I am getting my level 1 certification in nutrition.
Yes. Love that.
So I'm going through that right now.
Are you doing it through a school?
Precision Nutrition.
Okay.
Nutrition, yes.
Okay.
So it's a certification program, but they're very in depth, and they also focus on, mind and body connection, as well as obviously the food macronutrients, which I know a ton of that, but how I speak to a patient to make them feel comfortable, that is something I just want to make sure that I'm doing appropriately.
Okay. I love that. That's really good to know. You would probably think I was so crazy. Like, I'm so pro like carnivore.
Yeah.
So I just totally am anti the food pyramid, but I'm sure they're not teaching you that, surely.
No, they're not. They're very much
about, that is outdated.
Yeah.
AF.
It's awful.
Yeah.
It's awful. So
I wish I could be carnivore, but I try.
Yeah.
I know. I bring meat sticks to work. You don't know that, but I do.
I don't know that. That's awesome. I'm a macro person.
I love macro too, though.
Yeah.
I love counting macros. That was one thing that I did a lot with patients is like, balancing out the protein, carbs, and fats to make it a better ratio for their body mass.
Yeah. And then they're not eliminating something where they feel like
deprived.
Yes.
Yeah.
And
because that's my problem. I feel like, I really want that milkshake. Not on carnivore.
That's awesome.
No, I'm not hardcore at all. I'm not at all. Yeah.
Although I used to make lamb sticks.
Yes.
And I would eat those as my snack every so often.
Like a lamb lollipop.
Yeah. It's easy.
Okay. So you really do it all. Like, that's a lot to balance. Do you ever get like burnout?
100%.
What do you do?
And Darren, my boyfriend, would say this, I completely will disconnect from everything and everyone. We try to travel. We've not been able to recently, just with family matters, things like that.
Yeah.
But we definitely take off for a couple of weeks at a time. Warning, Haas.
That'll be fine.
We take off for a couple of weeks and I completely shut everything down.
Yeah.
I won't be on social media. I don't get on my phone.
Do you work out?
I work out.
Okay.
Actually, I'm one of those people who will take a backpack across Europe because I don't want to lose my luggage.
Yeah, right.
And then 2, I'd rather make it like something where, we went to Cinque Terre and we hiked to each one. And you experience so much that way and it feels good. So that's my disconnect. And I do it, once a year for a couple weeks at a time.
Right. I think that's so important. A lot of people that I've known throughout my life growing up that I found inspirational did the same thing. It's like you work really, really hard most of the year and then you take a large break. I think, for me, I haven't done that. It's like been through training, just constantly training, to get to where I'm at. And you never really have those large gaps. But I think that a longer break is really good because you actually get that time to totally disconnect instead of just having a couple days off where you're probably not really disconnected in the first place.
Yeah, 100%. I think a lot of people during COVID took time off. We were still working, I was still in the hospital. You were still in the hospital.
Yeah.
We didn't get to have that downtime. Even if you had reduced hours, you were still in every day.
And the level of stress that came with the whole situation, it's like there was no downtime.
Yeah. So I've been full go since basically 2021, we took one of those larger breaks. So spring of next year, I'm due.
Yeah.
That'll be a little over 2 years and we need it.
Yeah, definitely. That'll be amazing. Okay. So you do it all, which is why I wanted to have you on here. You've got the fitness aspect, you've got the wellness, you've got, doing the aesthetics, the whole mind body connection. And at the same time, like you're running businesses, like that takes takes a lot. And I think it's, something that not a lot of people are able to do and able to manage. Like, if you had to give, and sorry to put you on the spot, I didn't prep you with this question at all, but if you had to give, advice to someone younger who just wants to live a good life and be successful, like, what would you tell them?
So the biggest thing is be happy, whatever you need to do. Be just as happy to open the garage door to go to work as you are to come home. And then with that money that you are making, save it appropriately. Set yourself up for success. It doesn't have to be passive income. You hear so much people like, you need passive income. No, you just need income, and you need to know how to manage it appropriately. And then all of it falls into place. And then if the passive income happens, kudos to you. That's amazing. But, that took me years to achieve. And even so, that passive income has taxes.
Yeah, right.
So it's like at the end of the year, you're like, wait, what happened to this?
Right.
So I would say, keep working, manage financial health. Because
another aspect, are you going to get that certification too?
No.
Help me.
I don't ever want to.
Help me, I'm poor.
Although we were both shopping before we came in here.
I know.
But yeah, financial health, set yourself up for that routine, that consistency that you need every day to take care of your body, because in the end, it's only you that's going to take care of yourself. And don't be afraid of what other people think. Don't be worried about what they're going to say. There should be no taboo. There should be no taboo anywhere about anything, as far as I'm concerned,
Right.
Fat shaming, don't do it. Diet shaming, don't do it. Like, just be kind to each other and take that into what you're doing in life. And I think that would just create your setup.
Love it. Love it. Thank you so much.
Thank you for having me.
You're welcome. Okay. So again, Erica Boliek, it's at Erica Boliek. Follow her on Instagram. Is that your main way that people connect with you?
Absolutely. Yeah.
Okay.
I have a TikTok, but I don't use it.
I know.
It scares me.
We should work on that. We should work on TikTok. And also I heard Snapchat is making a comeback. So that's going to be our next thing.
I've never ever had that.
It's fun. It's fun. I do it with Charlie because he likes the faces. But okay. So follow Erica. Very important. Save, give me 5 stars, leave us a review, because we want to have more people come and listen to all of our amazing guests. Again, this was the Slimming Surgeon podcast with me, Dr. Kandace, and Erica Boliek. Thank you guys for listening, and we will catch you next time.
Thank you.